Hi, I'm Dr. Michelle Davis and I'd like to discuss the benefits of cervical screening self-collection, why it's relevant to our patients, how it works and practical ways we can champion this approach in our practice. Since July 2022, self-collection has been available to all eligible patients through the National Cervical Screening Program. Uptake is steadily increasing, contributing to Australia's goal to eliminate cervical cancer by 2035. Cervical screening has played a crucial role in significantly reducing cervical cancer rates. Self-collection offers a private, convenient and equally effective alternative to clinician-collected samples, reducing barriers like discomfort, embarrassment and refusal while being as accurate in detecting HPV, human papillomavirus. Self-collection can be offered to eligible patients aged 25 to 74 who are due or overdue for screening. Eligibility includes individuals with a cervix, aged between 25 and 74 and who have had any type of sexual contact. Self-collection has seen promising uptake, particularly among under-screened and priority populations, including culturally and linguistically diverse groups and people who have experienced sexual violence. Patients report high satisfaction with self-collection and importantly it's been shown to increase screening participation. I have had patients agree who have not had smears for years and have had self-collection results detecting high-risk HPV in several of my patients who would never normally consent to smears. I've had success with patients who've been previously sexually assaulted, who've required anxiolytics and extensive time for speculum examination, manage self-collection without need for medication or long consultations. Self-collection involves using a simple swab to collect a vaginal sample. Our role is to provide clear instructions, a private location for sample collection and follow-up once results are available. It's often quicker than clinician-collected samples and can be completed spontaneously during a consultation. Some patients will still require a clinician-collected sample, including those with red flag symptoms for cervical cancer, those undergoing a test of cure, patients recently treated for high-grade abnormalities, and anyone with exposure to DES in utero. These patients still need cervical sampling by us as clinicians. Patients may need reassurance about self-collection. However, many patients appreciate avoiding a vaginal speculum examination for routine screening. Education and gentle explanation of how to collect, its reliability, and the importance of screening remain key to uptake. I assure patients the only reason they'll need to return for a physical examination is if they have an abnormal result. Resources for patients on self-collection include translated guides and visual aids. Negative results mean patients are routinely rescreened in 5 years. For HPV positive results, further testing or referral for colposcopy is essential and guided by the cervical screening algorithm with appropriate follow-up always noted on the pathology result. This reduces the exposure of patients to additional pelvic examinations. If the HPV result from self-collection requires colposcopy referral, this then allows for cervical sampling for cytology to be collected at the time of this examination, reducing the need for at least one invasive examination. If colposcopy is not required by the algorithm, then the patient is followed up with clinician-collected cervical cytology and appropriate review thereafter. As GPs, we can be confident that self-collection is a reliable, research-proven method of cervical screening. From a practice perspective, it's quicker and preferred by most patients. In line with your normal practice, regular review of practice data continues to be necessary to identify patients due or overdue for screening, with targeted reminders and improved capacity to facilitate this opportunistically in consultation. Please consider integrating self-collection into your practice to increase screening rates and outcomes and continue making strides towards the elimination of cervical cancer. Thank you for your continuing commitment to your patients' care through the National Cervical Screening Program and for your consideration of incorporating self-collection as an important initiative for your patients.